To what did you aspire as a graduating college senior at Yale, and how has that aspiration changed since?
As a senior, I was knee deep in this work, as you know, and I think as a result, my aspiration was very tied to it. And by that I mean that I really wanted to take what I'd seen us do as college students in New Haven and what I believed and saw was really having an effect on teenagers' lives and make it something that could happen and happen well in communities that needed it across the country. And I think that really, simply put, was my aspiration. It still is in many ways. I think I've just, over the last 6 years of doing this work full time, realized sort of how much need there is and how much impact we need to have. So that at that point in time, that aspiration was, coming out of an experience rooted in that one community and knowing a little bit about the broader issues that we could address. And today it's rooted in a bigger perspective, a better perspective on how big those issues really are and how much work we really have to do. So I think I feel even more commitment to that aspiration than I did then.
You had an opportunity to affect change locally, and now you're looking at ways to affect change systematically.
Yeah, exactly. And nationally, I think the local community in which we started this has, New Haven has unto itself a huge amount of need, and I think that our work there and the work that continues to happen there for health education through the program we started is really important and needs to keep happening at the highest level it can. But I think to really address a problem like a lack of health education for teens, and teens in part because of that engaging in really high-risk behavior, is a much bigger one than any one local community. And ultimately, yes, we want to see systematic change. We want to see a national impact, and that's what we're working to do.